Struggling with back pain, hip pain, knee pain, maybe even ankle pain? It may all be starting in your feet. Hi, I'm Dr. Crockett and this is Dr. Sanders with Zeal Integrated Health, and today we're going to be talking about your feet and really orthotics, how they can improve not just your feet and how they feel, but all the way up through your body. You know, foot orthotics are a great tool to relieve the stress, not just in the feet, but by providing alignment in the feet, they're going to help the ankles, the hips, even your back really work better for you. So who can benefit from an orthotic, Dr. Sanders?
Well, like you said, anyone experiencing ankle, knee, hip, low back pain, people who have plantar fasciitis, even people with diabetes, arthritis even can benefit from orthotics.
Yeah, we see this in our clinic all the time, but there's a huge difference between a orthotic that's just off the shelf, something you might find at one of these big box stores, versus something that's been customized to the individual. Tell me about the benefits of getting something customized.
So when you get something customized, you actually get to speak to a professional who deals with fitting them all the time. On top of that, you get to get a biomechanical exam first. So like we said, you'll be experiencing knee, hip, back pain even sometimes if your feet are out of alignment. We want to look into those things because sometimes even it goes the other way. You may have a hip or a low back out causing your foot to hurt.
Definitely. And biomechanics is huge. A lot of times people don't look at these things, but if you think about this, if you've got a misalignment in your lower extremity, somewhere in the back or in the feet, basically over time, this is going to cause wear and tear on one side faster than the other. It's just kind of like an alignment to the wheels on your car. So you get the wheels out of alignment, one tire wears out faster. Well, in a human body, what's that equate to? You're getting one knee, maybe one hip replaced before the other one, and it's not age related. It's because you didn't get something corrected a long time ago. So it's important to look at these imbalances in your body because it's going to influence your quality of life down the road.
The quality of life is a huge thing. The sooner people notice these things, even if they're just experiencing low back pain, going to get it checked out could lead to finding a simple solution such as an orthotic to give you a happier, healthier life.
You bet. Now, we're going to talk a little bit about just the orthotics that we use here in the clinic. They're called A-lines, but this is something that has 3 arches in it. Your foot has 3 arches. One of them goes from left to right or side to side in the foot, and then there's going to be one that comes back and goes onto the inside of the ankle, and there's one that goes out to the outer part of the ankle. But it's important that these things are balanced, and we use equipment, a laser even, to analyze the mechanics of your feet in alignment with the knees and the hips to assess what's the right orthotic for you, and then we customize the angle on it to really help prevent these imbalances that cause wear and tear. So we also want to look at what the orthotic's paired with. You know, what type of shoe are you wearing it with, right?
Exactly. Right now, a lot of shoes are getting ordered offline. You don't try them on first. A simple size and type of shoe isn't enough to know how well it fits on your foot. There's a myth that, oh, the shoe needs to break in. Shoe materials used nowadays, they're soft, they're already broken in. You shouldn't have to break in a shoe. If you do, it's the wrong shoe for you. You want to be able to try on the shoes. So if you order a pair of shoes that you can't try on and return, you need to look in different options.
You bet. It's important to make sure it's a good fit. And that's where, just getting assessed maybe by somebody like yourself or the doctors here, is a good start on that. So usually we want you to bring the shoes in that you're going to be wearing the orthotic with, just so we can pair the orthotic up with the shoe. So I hope this gives you some insight on orthotics, and remember to comment below.